Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Dialysis. Introduction. When your kidneys are healthy, they clean your blood. They also make hormones that keep your bones strong and your blood healthy.
When your kidneys fail, you need treatment to replace the work your kidneys used to do.
Unless you have a kidney transplant, you will need a treatment called dialysis. This program explains how dialysis works and reviews the complications of dialysis and kidney failure. Information about adjusting to dialysis is also included, along with information about the dietary recommendations for people receiving dialysis. The kidneys. Kidneys are bean-shaped organs located in the middle to lower back on both sides of the spine. The urine that is formed in the kidneys flows through tubes called ureters to be stored in the bladder. When the bladder is full, a person feels the urge to urinate. Urine is emptied through the urethra. The main purpose of the kidneys is to make urine by filtering harmful chemicals called toxins out of the blood. The kidneys also help to keep necessary chemical substances in the blood, such as sodium, proteins, and sugars. The kidneys control the amount of fluid we keep in our bodies. For example, when we drink more fluids than we need, the kidneys secrete extra urine. On the other hand, when we do not drink as much fluid as we need, the kidneys make less urine. The kidneys help to regulate hormones that strengthen our bones and produce red blood cells. Since the kidneys constantly filter the blood, they are very sensitive to anything we eat or drink or to any medications we take. The kidneys also help to keep our blood pressure regular.
This is why many kidney diseases cause high blood pressure. Usually, damage to only one kidney is not a major problem since the other kidney can take over for it. However, if both kidneys get damaged, a person will die within a few days if they do not get dialysis.
Dialysis. When your kidneys fail, harmful wastes build up in your body. Your blood pressure may rise. Your body may retain excess fluid and not make enough red blood cells. When this happens, you need treatment called dialysis. Dialysis works by removing harmful wastes and extra fluids in the blood. This helps control your blood pressure and keeps the proper balance of chemicals like potassium and sodium in your body. There are two main types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis is the most common method used to treat advanced and permanent kidney failure. Hemodialysis uses a machine that cleans wastes from blood by pumping it into a machine, then returning it to the body. Pumps blood and watches the flow for safety. Watches your blood pressure and the rate of fluid removal from your body. During hemodialysis, your blood is allowed to flow into a special machine, a few ounces at a time, through a special filter that removes wastes and extra fluids. The clean blood is then returned to your body. Peritoneal dialysis uses a catheter placed in the abdominal cavity and a liquid dialysis solution rather than a machine to cleanse the blood. The lining of the abdominal cavity is called the peritoneum. Tiny blood vessels in the peritoneum cleanse the blood with the help of the dialysis solution. The dialysis solution contains a sugar called dextrose. Dextrose pulls waste from your blood into the abdominal cavity. The waste leaves your body when the used solution is drained from the abdomen to the outside through the catheter. Some people choose peritoneal dialysis because they are able to treat themselves. It also has fewer restrictions than other forms of dialysis.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Complications of dialysis and kidney failure. When your kidneys stop working, you may face a variety of problems. This is because your kidneys don't just remove waste, they also make hormones and balance chemicals in your system. Some of the more common conditions caused by kidney failure are bone problems, extreme tiredness, itching, joint problems, restless legs. Anemia is also a common condition related to kidney failure. Anemia is when the volume of red blood cells is low, causing a person to tire easily.
Kidneys usually produce a hormone called erythropoietin, or EPO, which stimulates the bone marrow to produce red blood cells. Diseased kidneys often don't make enough EPO, so fewer red blood cells are made. EPO is commonly given to patients on dialysis to prevent anemia.
Renal osteodystrophy affects about 90% of dialysis patients. Renal osteodystrophy is a bone disease related to kidney failure. It causes bones to become thin and weak or form incorrectly. Many people who are being treated with hemodialysis experience itchy skin. The itching is often worse during or just after treatment due to the wastes in the bloodstream that can't be removed from the blood. Many different treatment options are available for this side effect. Sleep disorders are also common in patients who receive hemodialysis. Sleep apnea is one type of sleep disorder that causes an interruption in breathing during sleep. Many people on dialysis also have trouble sleeping at night because of aching, uncomfortable, jittery, or restless legs. The causes of restless legs may include nerve damage or chemical imbalances. If a patient has been on dialysis for more than 5 years, another condition is dialysis-related amyloidosis, or DRA. DRA develops when proteins in the blood deposit on joints and tendons. This causes pain, stiffness, and fluid in the joints. The proteins that cause DRA are usually filtered out by the kidneys. However, dialysis filters are not effective in removing this protein from the blood. It is important that you follow your doctor's recommendations. Skipping treatment increases the risk of complications, including death. Adjusting to dialysis. Adjusting to dialysis can be hard. Both types of dialysis require adjustments in your life. One of the biggest adjustments you must make when you start hemodialysis treatment is following a strict schedule. Most patients go to a dialysis center 3 times a week for 3 to 5 hours each visit. For example, you may be on a Monday, Wednesday, Friday schedule or a Tuesday, Thursday, Saturday schedule. You may be asked to choose a morning, afternoon, or evening shift, depending on availability and capacity at the dialysis unit. Your dialysis center will explain your options for scheduling regular treatments. Some centers teach people how to perform their own hemodialysis treatments at home. A family member or friend who will be your helper must also take the training. Home dialysis gives you more flexibility in your dialysis schedule. With home hemodialysis, the time for each session and the number of sessions per week may vary, but you must maintain a regular schedule by giving yourself dialysis treatments as often as you would receive them in a dialysis unit. Peritoneal dialysis also requires an adjustment. Peritoneal dialysis can be customized to fit your lifestyle. However, learning how to give yourself peritoneal dialysis treatment takes training. Peritoneal dialysis also requires a set schedule, even though it is not as time-consuming as hemodialysis. During the time the dialysis solution remains inside your body, you can go about your normal activities. However, you must remember to perform the exchanges as often as your healthcare provider has told you to. Even in the best situations, adjusting to the effects of kidney failure and the time you spend on dialysis can be difficult. Aside from the lost time, you may have less energy. You may need to make changes in your work or home life, giving up some activities and responsibilities. Accepting this new reality can be very hard on you and your family. A counselor or social worker can answer your questions and help you cope. Many patients feel depressed when starting dialysis or after several months of treatment. If you feel depressed, you should talk with a healthcare provider. This is a common problem that can often be treated effectively. Diet. Eating the right foods can help improve your dialysis and your health. A dietitian can help you plan your meals. This section discusses a few general guidelines. Your dietitian can help you determine how much fluid you should drink each day. Extra fluid can raise your blood pressure, make your heart work harder, and increase the stress of dialysis treatments. The mineral potassium is found in many foods, especially fruits and vegetables. Patients with kidney failure cannot get rid of excess potassium except with dialysis. Potassium affects how steadily your heart beats, so eating foods with too much of it can be dangerous to your heart. Ask your dietitian about ways to control the potassium in your diet. Avoid foods high in phosphorus, such as milk and cheese, dried beans, peas, and nuts. Phosphorus can weaken your bones and make your skin itch if you consume too much. You may need to take a phosphate binder with your food to control the phosphorus in your blood. Salt can also cause problems for people on dialysis. Too much of it makes you thirsty. When you drink more fluid, your heart has to work harder, which affects it. Try to eat fresh foods that are naturally low in sodium and products labeled low sodium.
Most people on dialysis are encouraged to eat as much high-quality protein as they can. High-quality protein is found in meat, fish, poultry, and eggs. Protein from these sources can reduce the amount of a waste product known as urea in your blood.
Your dietitian can tell you how many calories you should consume each day. Calories provide your body with energy. Some food sources are healthier options than others, so ask your dietitian which foods are best. Vitamins and minerals may also be missing from your diet because you have to avoid so many foods when on dialysis. Dialysis also removes some vitamins from your body. Your healthcare provider may prescribe a supplement made specifically for people with kidney failure.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Healthy kidneys clean your blood by removing excess fluid, minerals, and wastes. They also make hormones that keep your bones strong and your blood healthy. When your kidneys fail, you need treatment to replace the work that your kidneys can no longer perform. There are two types of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis uses a machine and special filter to remove wastes from the blood. Peritoneal dialysis uses a sugary solution and the abdominal cavity's lining called the peritoneum to cleanse the blood. Eating the right foods can help improve your dialysis and your health. Your clinic has a dietitian to help you plan meals. Follow the dietitian's advice closely to get the most from your dialysis treatments.
Thank you for using Explain.